Hello everyone, how's it going? In the last 20 years, the number of adults that have been diagnosed with diabetes has actually more than doubled. The CDC says that there are about 38 million Americans who have diabetes. Approximately 90 to 95% of them have type 2. Well, what symptoms should we be looking for? What complications can arise, especially if it's left untreated? And who are most at risk? If that sounds interesting to you, then keep watching. Now, there are about 1 in 10 Americans who have diabetes, and type 2 is the most common form of diabetes. Now, I knew that having type 2 diabetes could actually lead to many complications, but I learned about one recently that I hadn't heard about before. I'm going to share that with you a little bit later in the video. So when someone has type 2 diabetes, their pancreas doesn't make enough insulin and/or their body doesn't use insulin properly. So when type 2 diabetes isn't managed properly, what can happen is you could wind up having too much sugar circulating in the blood, and then over a long period of time it can actually damage several areas of the body. Well, what are some of the symptoms? Well, some people's symptoms can be so mild that if they don't keep up with their wellness visits, they could actually be living with type 2 diabetes for many years before they even know that they have it. But some of the typical symptoms would be increased thirst, frequent urination, increased hunger, possibly unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections. For women, that could be frequent vaginal yeast infections or urinary tract infections. You may experience tingling, pain, or numbness in your hands or feet. You may notice some darkened skin. It's usually seen in the underarm area and around the neck. All right, now let's talk about some of the complications, but just keep in mind that we can lower our risk of these complications if we're getting the appropriate treatment for type 2 diabetes. So one of the big ones would be cardiovascular disease. It's actually the leading cause of death for those who have diabetes. There's chronic kidney disease, which is very serious. Diabetes is the leading cause of chronic kidney disease. We have to be concerned about diabetes-related eye disease. There's also neuropathy, which is actually nerve damage, and it affects about half of the people who have diabetes. You could also have foot complications, possibly, and that could possibly lead to amputation. There are certain skin conditions you may have to deal with. It could affect your oral health. You're more likely to have sleep apnea, dementia, and your risk of stroke is greater. In fact, your chance of having a stroke is twice as high when you have diabetes compared to those who do not have it. You're 2 to 3 times more likely to suffer from depression. And then that other complication I mentioned before, we're going to get to that pretty soon. But first, let's talk about those who are most at risk. Before we move on, though, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, just a reminder to open up the description box below. There you can check out some links. You'll be able to read more information on this topic. And also to make sure you feel free to leave a comment if you have something you'd like to share on this topic. So what are these risk factors? Well, one is definitely if you're overweight or obese. Those who store fat mainly in the abdomen area. If you lead a sedentary, very inactive lifestyle, that could actually put you more at risk. If you have a family history, so you've had a parent or sibling who's been diagnosed with diabetes. Your race or ethnicity can also put you at more risk if you're Black, Hispanic, Native American, or Asian. And also Pacific Islanders are more at risk for type 2 diabetes. If you tend to have low levels of good cholesterol and then high triglycerides, that could put you more at risk. Our age, unfortunately, can put us more at risk, especially after age 35. If you're pre-diabetic, of course, that makes you more at risk. If you had gestational diabetes while you were pregnant, if you had a baby who weighed more than 9 pounds at birth, and if you have polycystic ovary syndrome, you're more at risk for type 2 diabetes. Now, the surprising complication that I learned about was actually hearing loss. There was a recent study that found hearing loss is twice as common in people with diabetes. And then the nearly 98 million pre-diabetic adults in the United States, their rate of hearing loss is actually 30% higher. The good news is if you have type 2 diabetes, it's actually highly manageable and there are many effective treatment options. Of course, it'd be better to avoid getting this condition in the first place. When I was reading about prevention, I thought it was interesting that it said that losing 7 to 10% of the body weight can actually reduce our risk. Now, it's easier said than done, for sure, to lose weight, but say you weigh 200 pounds, you can make it a goal to lose 10 to 14 pounds. It can actually make quite a bit of difference in your risk. Also, we want to try our best to eat healthy. You want to stay active, or if you're not active, you want to make sure you get active. We can monitor our blood glucose with our doctor, or use a home monitor kit. If you quit smoking, that can help reduce your risk of getting type 2 diabetes. Now, if you've already been diagnosed with type 2 diabetes, there are actually many things you can do to help prevent or delay these complications. One of the most important being making sure you have regular visits with your healthcare provider. You definitely want to try to maintain a healthy weight. You want to make sure to get in some exercise. Try to find something that's fun, that you enjoy. It doesn't have to be anything really long. I know I enjoy doing exercise DVDs or finding nice workouts on YouTube, just to give you something to do a little bit every day that's manageable. Especially every 30 minutes, you want to try to get up and try to do something for a few minutes if you can. Now, when we talked about these complications before, you can see that it's more of a matter to consider than just living longer, but we actually want to have good quality of life and improve our overall health. By managing your type 2 diabetes, this can actually be done because you can have more energy, reduce your risk of depression, reduce your chance of vision or hearing loss, less chance of having to deal with foot ulcers or bacterial or fungal infections. So getting treatment is definitely worth it. That being said, it can be sometimes expensive. You may or may not have insurance, or depending on the type of insurance you have. But I'm going to leave a link below in the description box to the American Diabetes Association. If you go to their website and then scroll all the way to the bottom and click on tools and resources, they have a lot of really helpful information there, including information on healthcare affordability support, because you definitely want to get care. The American Diabetes Association actually recommends regular screenings for people over 35 years of age, but they actually recommend it even younger if you're overweight or obese, or you have one or more of these risk factors. So if you feel that you're at risk for having type 2 diabetes, definitely want to make sure you get screened, because an early diagnosis and proper treatment can really help you avoid many of these complications that could come along with having type 2 diabetes. Well, I hope you've enjoyed today's information, and I hope to see you in the next video, where we'll discuss another way we can improve our health.